Okay. This is a special guest speaker because he's awesome. She was my lab tech. She was a student of mine. She's been very active both here at Cal State and Loma Linda. So she'll be able to give you guys a very vivid, accurate picture of kind of both parts of those worlds, what it looks like. Okay. So I'll turn it over to Alma.
So a little bit about myself is I don't like public speaking, and I'm also kind of an introvert, but I try to push myself to do things that I don't enjoy. So at any moment you can't hear me or anything, just let me know. Not on purpose, I just tend to not do those kind of things often. So like Van said, I graduated from Cal State. I was I grew up in the area, so I grew up in High Grove, which is maybe like 20 minutes from here. Not like a super posh area of town, so that was also something that impacted the way when I started school super late. So a little bit about myself. I love animals. I grew up with like goats, chickens, horses, parrots. I have like 10 dogs right now, which is kind of crazy. I like reading, traveling. Like I said, I got my bachelor's in allied health, and then now I'm in a doctor of physical therapy program at Loma Linda. Personally, I feel like my philosophy and the things that I've carried throughout my education here at Cal State and Loma Linda is that movement is autonomy. Oftentimes I hear like, oh, PTs just walk people. Like they think that that's something super simple, right? Like just walking. But if you think about someone that had a spinal cord injury and can't move anymore, they can't pick up their cups, they can't pick up their dog, they can't walk to the bathroom by themselves. Like that is a loss of your identity. So really movement is autonomy, it is your independence, it is who you are as a person. So something about my time here at Cal State, I was a transfer student from San Bernardino Valley College. I was actually in the workforce for about 10 years, so I decided to go back to school at like 25, 26. Initially, I wanted to do nursing. Then COVID happened and I got to see a little bit of like the craziness that people don't usually talk about when there isn't a pandemic, I guess. Nurses were telling me a lot about the abuses they put up with from patients, just like the degrading that they got from a lot of doctors. And a lot of that was exacerbated because of the pandemic, but I realized just with my personality that was not something that I was going to be okay with. And I've always been very autonomous and I've always been kind of someone that takes leadership roles. And I knew that working under someone for the rest of my life wasn't going to be something that I wanted to do. So I started just shadowing people. Like I had PT once on an ankle, and so I went to go shadow PT. I shadowed OT, I shadowed speech. And I think PT really spoke to me. Like I said, that movement is autonomy. That's what really spoke to me about PT, like getting people back to functional independence and being able to do things on their own. So that's why I ended up switching to Kines. So really just figuring out how the body works and how we move and how we can improve all of those things. As Van said, I was a lab tech, so I was in the XPhys lab and the biomechanics lab. I also was a research assistant, and I would recommend that to all of you guys. It's great experience. You learn how to write IRB proposals, grants, you go to conferences, you can present. So a lot of those are really good experiences, especially if you're planning on going to grad school. Those are things that will set you apart for sure. And then I was also a learning assistant, so that's kind of like a tutor for biomechanics. A little bit of a brag, but I was also awarded the Outstanding Student of the Year award, and the American College Association, which is our national association for kinesiology, also granted me an undergraduate scholar award. So I knew I was going to go to PT school, and it seems kind of daunting when you're a student. You're like balancing your classwork, and you're like, okay, what do I do? So the very first thing that I would recommend, no matter what you decide to do, even if that's not PT or OT, I know you had OT like Tuesday, right? Whatever it is that you decide to do, research the program that you're gonna go into. So like research what the job actually entails, what the schools require of you, what are the school's pass rates. Like those are all super important things because you don't want to go to a school that has a good name or is, I don't know, in an area that you want to live, but their pass rates for their board exams are super bad. I don't want to call out any schools, but there's a school who has a 67% pass rate, and they were really happy about that, which means almost half of their class fails the first time. Yeah. So those are super important things. And if you guys want tips on how to find that information, I can give you that. I can help you after or with the essay sessions. But that's, I think, the most important thing when you're deciding if you want to go to grad school, like figure out what those things are. Also, what are the mission and the values of that school? Because every school is going to treat the program different based on their values. I chose to go to Loma Linda because they're very whole person oriented. So they look at people as not just their illness, but also what is their socioeconomic status? What is affecting them mentally that is impacting their health? So it's a whole picture overview. And that really spoke to me. There's a big aspect of community service. And so those are kind of things that you want to see the school matches with what you want to do. Otherwise, you're not going to have a good time when you're in grad school. Also, you can go to tours. Most programs will give tours to prospective students, and they'll usually have students in the program already. And that's a great time to ask them, like, what are your professors like? What is the support like? Do you have one-on-one time with your professors? Because that's super important when you're choosing to go somewhere and spending so much money, which grad school does cost. Particularly for PT, I don't know about OT or speech, but I know PT for sure. They require you to do observation hours. Loma Linda does a minimum of 80 hours, I believe. And so you have to go and shadow a PT for 80 hours, which is really good, I think. And I wish more programs did that because then you actually see what the day-to-day of that profession is like. For example, a PT might think that you're always going to work in sports, but a lot of times it's going to be, you know, someone's dad whose back hurts, your grandma who just had a knee replacement. And so realizing what you're actually going to be doing is super important. Also, like PT does a lot of documenting. And so if you're like, I don't want to be on the computer at all, then that would be something to consider. So I advocate that a lot. If you get the chance, go and shadow people, because then you can see what that's like. Also, most programs will ask for a letter of recommendation. And if you don't have a lot of time talking to someone in the profession, it's going to be hard to get a letter of recommendation from them. But yeah. A lot of grad schools also ask for the GRE, which is just like an entrance exam. They analyze like critical thinking, your math skills, your writing skills. Loma Linda doesn't require that anymore. So I'm glad, but schools still do. It's usually like a 2-hour test and it's like $200 to take it. And then finally for PT specifically, and I know OT does something similar, there's a centralized application system. It's called the PTCAS. And it's really nice because you can go there, you can look at all of the programs that you're interested, see what their requirements are, what their GPA minimum is, what their fees are like, when the due date for the application is. All of that information is usually there. If you're not choosing to do PT, I'm sure you can find that information on like the school's website and stuff as well. Any questions so far?
You recommend doing all your observation hours in the same facility or spreading them out and getting?
Yeah, good question. I definitely think you should try out different places. Because say you get really lucky and you go to a place and they're like amazing and you have the best experience and you're like, yes, this is what I want to do. But then you go to your first clinical rotation and it's, you know, the worst. They're just having you see 5 patients an hour. So like getting to see different places, how different facilities organize themselves, how different clinicians treat patients is really important as well. Also, they usually want you to do 2 settings. They want you to do outpatient and inpatient. I also tell students, like, don't just go to a hospital and ask, go to a skilled nursing facility, go to like a long-term care facility, like all rehab hospitals. Those are very different, so you'll get to see different aspects of the profession. And actually, when I was doing my observation hours, I went first to an outpatient like ortho clinic. So like if you broke your ankle or you had an ACL repair or something like that, that's where you would go. And I hated it. Like I was like, PT's not for me. But then I went to a hospital and I actually ended up falling in love with just like the way that we take care of patients. They're so different. So one setting might not be for you, but you can find other settings that you. Yeah. And then I know a lot of people don't know what a physical therapist is. Most of you probably do if you're in Kines, but physical therapists are movement experts. That's what our organization calls us. That's the movement. We're all supposed to be movement experts. And our goal is to improve quality of life through hands-on skills, through education, and prescribing exercise and movement. And I was just telling them why I bought this earlier, but I didn't realize how much teaching I would be doing as a PT. So that's another thing to consider when you're doing your outpatient, like your observation hours. Like if you don't like teaching, pay attention to how much people have to explain things. That'll be a big part of the job in any kind of healthcare field. Really, you'll have to do a lot of teaching. A lot of people skills are going to be required. And so if you don't like people, that's also not going to be a good option for you. I just wanted to showcase the different, I guess, settings that you can work in, and PT really is throughout the lifespan. So the very first picture, that's a NICU patient. That's usually like if babies are born premature. Sometimes their lungs don't develop fully or their heart has a defect, so they need to be on like a ventilator or they need to be on something that makes their heart pace. And even from that early start, PT is very essential. We help integrate their sensory system and like adapt them to the outside world so that they're not so stressed out. Then of course you go through pediatrics, so we can go all the way from like 3 years old to 17, that's usually pediatrics. There can be sports, but also you can have children with disabilities like cerebral palsy or different things like that. And then of course our adults and seniors, which is probably more common. So these are a couple of pictures of just things that we've done recently. In the very top corner, we do take XFIS again. So that was always fun. We recently went on a mission trip to Mexico as well. We went to an orphanage. They don't really have PT services in Mexico, so a lot of those kids are either like disabled or they have chronic conditions that need help. We also have stroke patients that come in. I don't know if you can see the here. Oh yeah. So we have our neurology course, brings in patients from the community. These are stroke survivors. So a lot of times with stroke, they lose use of a hand or a limb, sometimes multiple. And so we learn how to make that move again, give them some more mobility, prevent that from getting stuck. We learn soft tissue techniques, which is just massage. So that's always nice at the end of the week to have a massage class. There's a lot of studying, a lot. And here we went to like a ballet dancing group and we did a screening. So we were screening them for any like hyper mobility. So if they were super flexible, that could also cause them to get injured. Strength, because it takes a lot of strength to be able to hold up your entire body when you're doing point and just putting all of your mass on your toes. We did also some like core things. So we, like I said, Loma Linda very much focuses on community and giving back and participating and making our community better. So those are some of the things that we do out in the community. This is my kiddo. He is 5 and he has cerebral palsy, which is like a stroke for a child. So he doesn't really have control of his body. As you can see, like he doesn't have control of his head very much. His hands kind of flail and his legs always want to rotate. And so we're working on having him tolerate standing upright, but also with kids, it's super important that we don't teach them how to do things. How do I say this? Not deviated from normal, because they don't know what to do, right? Like they were just born, they've always been this way. So we can teach them how to do things that work for their body and don't cause them pain later on. That's ultimately our goal. So it's a lot of teaching him to feel his body and where he is in space and to really work on his strength. This one, this one as well. This is one of our professors, and I call him a MacGyver. He like builds all kinds of contraptions. This is like a sliding board, and we would sit on it. And so for people that don't have good ankle mobility, which I don't because I've injured my ankle a lot of times, this is really good because you have them pull back, activate that muscle, and then they have to control the descent back. So that works a lot on the eccentric muscle control, which is a lot of times harder. He also made this, like, I wish I had a picture of it, but he puts together these two standing walkers. So like one in front, one in the back. And then he puts like sticks and then he ties them together. And then he does like a TheraBand and he wraps it around their legs and comes back and ties it to the walker. And what it's supposed to do is actually simulate movement. Because if we're walking people with a walker, we're taking away their ability to go side to side, that transverse movement. And so in order to mimic normal as much as possible, we have to get creative all the times, which is another thing I didn't realize how creative you have to be in PT. But yeah, he comes up with the craziest contraptions. I wish I had another video to show you guys. And then the last thing, I was also part of the anatomy scholars program. So most PT programs, the very first course that you will go into is anatomy. It is very different than like undergrad anatomy. There's just the amount of information you have to learn is a lot. And you have to go through every single muscle, every single nerve, and every single blood vessel that innervates it. So you go layer by layer. Loma Linda does a 6-week like full immersion as soon as you start, which I personally like because you don't have to worry about any other class. You're just like 8 a.m. to 5 p.m. anatomy. That's all you do. Excuse me. But we also have the opportunity once we go through the course to be a teaching assistant, and we do a whole another dissection, and then we get to teach the following summer, which was pretty cool. Yeah. Any questions on any of this? So I wanted to leave time for any kind of questions, and I didn't have anything in here about loan, but I know that's also a big topic of conversation, so we can talk about that as well. But really figuring out why you want to do whatever it is that you want to do, whether that's OT or PT or speech, PA, whatever it is that you decide you want to do, even if you're like, I don't want to do anything with Kines and you go somewhere else, like figure out why you want to do it. And if that's really something that speaks to you, your values, and what you want to do with your life. Because otherwise, there's no perfect job. Every job is going to have its ups and downs. You're going to have bosses that you don't like, coworkers that you don't like. And if you don't really enjoy what you're doing, it's going to be super hard to go through your life that way. And like I was saying, just go shadow people. I know that's like, I don't want to give up my Friday morning or whatever, but just giving some of your time now will save you headaches later on. So I really advocate going and exploring different options. Connecting with your professors is so important. There's so many opportunities here at Cal State that if I hadn't been someone who was like just talking to my professors and asking what I could help with, what I could do, I wouldn't have been a learning assistant. I wouldn't have been in lab tech or gotten into research. And a lot of those opportunities are the things that set me apart from other people that applied.
You bring me breakfast burritos and coffee. Saying yes.
I did bring you breakfast burritos. But also you're a really good boss, so you earned it. But yeah, just talking to them and seeing what you can help with. A lot of the professors have their own research. So if you can get involved in anything, that would be a recommendation because like I said, that'll really set you apart. And then lean into the hard things, like the things that are scary, the things that make you uncomfortable, those are the things worth doing because they challenge who you are now and they turn you into someone better, someone who can face adversity and come out of it on top, right? So that sounds very cheesy, but honestly, if you just push yourself to do things that you don't want to do, you usually come out a better person. Like here, speaking in front of people. I don't like doing that. But and then I know a lot of times this is like an intro class, but a lot of you might also be close to graduating. So seeing yourself as a professional that you want to be is super important, carrying yourself that way. I think a lot of what I noticed, so I'm a second year PT student, I don't think I said that. First year, we go through all of our classes and then we go on our clinical rotation at the end of the year. And a lot of my classmates, I think, didn't view themselves as PTs, they still thought of themselves as students. And so then they got to their clinical rotation and they were so overwhelmed by the responsibility that came with that. But if you start thinking about yourself and what you want to be, like when you're going through your courses, I think it helps you learn things a little bit different. Like you're not learning for an exam. You're learning because you're going to treat someone's grandpa, someone's mom, someone's child. Like there's such an important responsibility that comes with that. So seeing yourself as a professional, whatever it is that you want to do is super important. Start thinking about yourself that way because you are capable. That's what you're doing, right? You're honing those skills to become that professional. So that's super important. And yeah, don't be afraid to ask questions. Like I came from an immigrant family. Like if you didn't ask for help, you weren't gonna get it. And so the worst thing that someone can say is no. At least you figured out, right? Like so always ask. And if you make a mistake, that's okay. It's nothing in the world. No one's gonna die because you made a typo. It's totally fine. One of my professors likes to, it used to stress me out, but I think now it kind of motivates me a little bit. He would end every class saying, one out of, I don't know, it's like 1 out of 200 people gets a doctorate degree. And like you are that one person, right? So I pulled up statistics and apparently only 27.9% of the US population gets a diploma. And so all of you are part of that 27. Like you already did something that most people don't do. 23.5% of the population gets a bachelor's. And you guys are here, you're working on that. About 12% of the population gets a master's and only around 2% get a doctorate degree. So when you are here and it feels overwhelming and life is hard, like you're doing something hard and it's okay to feel that. It's okay. Just know that you have resources, like talk to your professors, talk to the counselors, like you're not going to have free insurance for a long time. So use the resources that you have here. Go to the doctor, go to the therapist, get tutoring, whatever it is that you need. Because you are doing something hard. So let's see. I think that's it. Talking about Nelson. This is one of my favorite professors, Dr. Nelson. He is our neurology track professor. And he'll have us in lab and he'll have the most crazy scenarios. He'll be like, for example, this one, he was a rat farmer and he kept passing out in his rat farm because he had like 4 beers by 8 a.m. So like, it was super crazy stories that he makes you think about, but it's really to teach you how to like hold your composure. How do you view someone despite whatever, you might think about them? Like, yeah, you might be like, well, yeah, you're passed out because you're an alcoholic, but that's still your patient. So I think he does a great job of preparing us and he always encourages us. So I had that picture because I think it's important to just think about other people. Why, like I was saying, why you do this, but also remember that everyone else struggles as well. And so you have to be empathetic in anything that you do. But yeah, so now we'll open it up to questions. Any questions you guys might have? I
want to go into PA, and one of the schools that I want to go to is Loma Linda. And I just want to ask like how the classes work or like how it is.
I don't know a lot about the PA program. I can tell you about the school in general. PT, for example, our faculty to student ratio is 10. So in lecture, it's different because lecture, you're just talking, but in labs, it's all 1 to 10. So you'll always have support from our professors. I know PA is a little different because you guys have to do like 2,000 clinical hours, something like that. And then, so you'll already have a lot of clinical background. And then I think that you guys have clinical education threaded throughout. So it's gonna be a little bit different than like PT. Like I was saying, we go through our whole like classwork and then we go on clinical rotations. But I will say that a lot of the nurses and a lot of the medical students on campus really like that we have the hospital right next by because that's a resource that they have. They go there all the time. And a lot of people want to work there. And so being a Loma Linda student, a lot of times you do have an advantage over other people. So if you wanted to stay in the area, that's something that you could do. But I can help you look up like a contact. Like I said, they do tours of the programs. So you can sign up for a tour and then have someone from the PA program talk to you about it.
How do you recommend like getting like to shadow stuff?
Yeah, let's see. PA, it can be anywhere, right? So you can go like a doctor's office, or even like the plasma donation centers, like those can as well. But a lot of hospitals have volunteer services departments, so like people that go volunteer and they either work in the cafeteria or things like that. I would look for those first. If you wanted to get hospital hours, I know that it's a little bit hard, but after COVID, a lot of hospitals don't want to take volunteers, but that would be the best way to do it. And I do know the county hospital in Riverside. I know the volunteer services person, so I can give you her information if you wanted to, but she's in Mobile, so I don't know, it depends on where you live too.
That's fine.
Yeah.
Thank you.
Any questions? The other thing that we were talking about is loans, and I know that there's like a lot of confusion about the like non-professional degrees and whether that affects your loans. I think the biggest thing for that is to make sure that you go to a school that is affordable. Like you don't want to go, for example, USC is great, but USC's PT program is $250,000, and PTs graduate and make between $70,000 and $90,000. Like I'm not gonna go get a $250,000 diploma and make $70,000. That's insane. Because all PTs, no matter where you graduate, you're gonna make about the same amount of money. So looking at what your school costs and what the profession ends up making is super important. Living below your means is super important. Like you're already a student, so you're already used to living on a student budget. I would continue that in grad school. Don't take up more than you need. So for example, Loma Linda's PT program is about 120, 130. You can still take out 20,000 of unsubsidized loans from the government every year. So that would be 20,000 times 3, that's 60,000. And then you can take up to 100,000 of the grad plus loans. So that's 160,000 that most students can take out for grad school. If you don't need more than that money, don't take it. Because then you're gonna end up having to take out private loans. Yes.
To add on to that, also look into like the surrounding area that your school's at. It's like how you said USC, I think Chapman as well is upwards of like 180 grand. And they're great schools, don't get me wrong, but living in Irvine and going to LA and driving, all that factors into your cost of living. While, I mean, for an IE, it's a little bit cheaper, traffic's a little bit less, and your groceries, your bills, all that factors in. It's not just your tuition.
Yeah.
So that's a big thing to think about as well.
Yeah, and another thing that I know I'm like just adding on to it, but a lot of times if you're going into a medical profession, you are going to need to pass a board exam. Those all come out of your pocket, so the school doesn't pay for you to take the board exam. It's like $500 or something like that. And then if you want to get like the study prep courses or something additional to what your school provides, that's extra money. So saving your money and not like spending it on things that you don't need early on will help you be able to not feel so stressed later on, because you don't want to be worried about money on top of passing your boards. And a lot of schools will also have like a listing board or like a community board where people will put rooms for rent for students. Those tend to be cheaper than if you go find an apartment. That tends to be more expensive. So like I know Loma Linda, you can find a room for rent. Usually it's like a house that people rent to students for like $500, $600. Whereas an apartment anywhere in SoCal is going to run you like $2,000, and that's probably on the cheaper side. So really making those conscious financial decisions when you're young is super. Yeah, because they will come back to get you. And there's a ton of scholarships also. I should have put that on there, but there's different organizations depending on what field you're going into that have for that specific field will have scholarships. And then there's like state organizations that will also have scholarship opportunities. And again, apply to as many as you can, because the worst they can say is no, but you'll get some money too. But yeah, so it is a very important thing to think about. It's very grad school. Anything else? Yeah, of course.
So I mean, I'm biased because I'm going with it, but
Me too.
something that I wish I knew was the pathway. I started my pathway not knowing what to do. And like talking to your teachers, getting into research is huge. That I believe sets you up for success. Like the amount of information that you get from lecture is great and it helps you pass your classes, but actually doing research and getting to know like the ins and outs of writing an IRB, going to different locations, going to different like talks and hearing about what other people are researching, it really opens you up to not only different fields that you might be interested in, but it also gets you into contact with like Professor Ng. I didn't know Professor Ng until research, and then I had a class with him. So that just like levels you up kind of in their eyes. You're already exposed to like the world of research, and it will treat you more as like instead of just like another number in the class. And if you do need a letter of rec, getting to know your professors and like not just taking their class and then see you later, that'll come back to either haunt you if you do that, or it'll come back to help you. Like got an LR from Professor Chen, she's the exercise physiology teacher. Super tough class if you don't pay attention, but if you get to know the professor and you ask questions and you become more engaged in your classes, it'll become a lot easier. Also, like Professor Ambanti wrote me one. Teaches a lot of Kines classes. You guys haven't taken him so far, but he's a great teacher. He's very knowledgeable, and getting into a research opportunity with him might expand your worldview. Also, maybe go on, but
Yeah. I think too, a lot of the opportunities that I talked about, like being a lab tech, being a research assistant, being a learning assistant, those were all paid positions. And so having a job while you're in school that can accommodate your schedule is the best option, I think, for students. And I don't think I would have had those options if I hadn't been so involved with the department, because then a lot of times it was like, hey, would you like to do this? Like I didn't necessarily go out and apply. I think I applied for the lab tech one, but the other ones, they were kind of like, do you want to do this? Or hey, you could be my research assistant and they'll pay you. So just connect with your professors. We've seen this, I didn't put this on there, but I'm also a student ambassador for the DPT program at Loma Linda. And so I'm part of the admissions process. We are there when you guys take your interviews. They will ask us what you guys will, like, the ambassadors think of the students, like were they cordial, were they professional? A lot of that comes back, and I think that's something that sometimes people forget, that the interview starts as soon as you enter a place. But I'm digressing, sorry. What we've seen is a trend of people asking for letters of recommendation and not really knowing the person or checking with them. And so when someone writes you a letter of recommendation, they have three options. They could say, I highly recommend the student, I recommend the student with reservations, or I don't recommend the student. And we've seen a lot of students apply with, I recommend, but I have reservations, or like flat out, do not recommend. And so if you're asking people that you don't know to write you letters, you're kind of shooting yourself in the butt. So really getting to know the people that you are here at the school with, you will be working with, that will be your peers at some point. That's super. Yeah, you have to ask a time. Yeah, so we've seen a lot of people whose just application automatically gets disqualified because they didn't take the time to, one, probably ask on time, or get to know the people that they're asking letters for.
dress to impress.
Yeah, there's been a couple people that show up in jeans. I don't know. I think the interview process in general is still very traditional. So like you can't be overdressed for an interview, but you can be underdressed. And that says a lot about how you prepare to be somewhere if you don't show up the way they expect you to. So if you're showing up in jeans or like with Crocs, I don't know, no one's done that yet, but like if that's how you showed up, that tells them that you didn't really think they were important enough to put an effort in, or that you are not the professional that they would want in their program. So that's super important too. Get up early, do your hair, dress nice for any interview that you do. And you'd be surprised how that sets you apart now too. I think before that was kind of the standard, but we're seeing like people don't really put in that effort. So when you come in your suit or you come in your professional on your slacks, like that already sets you apart from other people. Also, don't be late. That's like a big thing that people get really irritated with is people show up late. Whether that be to class, like we have students that have shown up late and they get written up. They're like, you're gonna go out and you're gonna be a professional. For example, if you're in healthcare, your patients are showing up for their appointment time, they expect you to be ready. And if you get there at 8 and their appointment's at 8 and you haven't reviewed their chart, like you're not ready. So they expect a lot of promptness. So I think a lot of what you practice here in undergrad is like showing up to class on time, doing your assignments on time, that like kind of prepares you to have, I guess, a practice of like getting up and timing doing those things. Anything at all. I'm an open book.
What do you recommend for like interviews, like tips or?
Going back to the research part of it, so like looking up wherever it is that you apply. So if you're looking at PA programs, look up what their mission statement is, look at what their values is. Every single company will have a mission and a value, and they want to know that you've looked into them, that you are sure that you want to be there, not that, you know, it was just one of the options that you have on your list. So always look those up, and find some way to bring that up in your interview. Like, for example, for Loma Linda, like I said, their motto is to make men whole. And I talked about how, you know, there's a lot of disconnect between, you know, like Hispanic community and healthcare in general, because there's been a lot of, you know, things that have happened in the past. And so I want to make sure that my community feels seen, feels heard, that they, despite their, you know, economic states, can get access to the care that they need. So showing that you've looked at what their values are, and that they do mean something to you, not just that. Also, don't use the same answer. Like most places will have a panel of interviews, and if you use the same example for every single interviewer, then after you're done, they all get together and they talk, and they'll be like, well, she told me the exact same thing 3 times. So they don't really know you, and they're not really gonna choose you over someone else that was more open and had various examples. So like never memorize anything, but have different examples that you can pull from. Yeah. Yeah. Yeah.